In 2005, Jamaica ratified the World Health Organization's Framework Convention on Tobacco Control. In 2013, the island implemented the Public Health Tobacco Control Regulations, which call for, among other things, smoke-free public and workspaces. However, there is still prevalent tobacco and nicotine use in the country. Smokers are particularly vulnerable to COVID-19, which affects the respiratory system. A joint parliamentary select committee is now considering legislation aimed at tobacco control. Legal consultant in the Ministry of Health and Wellness, Albert Edwards, outlined the provisions of the bill when the committee sat on Wednesday.
Tobacco control, what it is. The bill defines in Clause 2 tobacco control, a range of supply, demand, and harm reduction strategies to improve the health of the population by eliminating or reducing the consumption of tobacco products, etc. This puts the structure of the approach to tobacco control in context. Basically, one seeks to control demand on one hand. So there are measures relating to controlling demand of persons for tobacco. And in relation to those, we will see price policies, provisions relating to management of premises, etc. And then there's a supply side, which deals with trade aspects and also control of access by children, by young persons. So supply, demand, and then harm reduction, which is a particularly new element that we'll see in the tobacco control bill.
The bill seeks to give effect to the WHO Convention on Tobacco Control.
Now, what we have done is looked at the main themes of the convention, because the bill is intended to give effect to the convention. So the main themes are price and tax control. This is not going, at this point, included in the bill before us today, but there are provisions in other pieces of legislation, as I think many of us would know, that deal with price strategies in relation to tobacco products. Prevention policy. Now, non-price measures. So the tax and price measures are the price measures to reduce demand. We have in the bill significant provisions in relation to non-price measures.